everybody. Nurse Jamie here with the School District of Waupaca. You have heard people talking about a new type of coronavirus called COVID-19, and you might be wondering, what on earth is it? It's a virus. Viruses are tiny particles so small that we cannot even see them. Even though we can't see them with our eyes, they can actually make us sick. We can see viruses under something called a microscope. A microscope zooms way into tiny objects that we cannot see with our eyes alone, almost like binoculars. When we look at different viruses under the microscope, each virus looks different. Even though they look a little different from one another, viruses have something in common. They all have little bits or pieces that stick out of them, kind of like some of the big versions of viruses that I have here. These pieces that stick out are designed to stick to different parts of our body depending on what the virus is. I'm sure all of you know someone who has taken time off of school because of something called the common cold. The common cold can be caused by a type of coronavirus. The coronavirus that causes the common cold has pieces that are designed to attach inside your nose or your throat. That can give us a stuffy nose, sore throat, make you feel really miserable. Usually with the common cold, you just rest for a while. Drink lots of water, maybe take a little medicine if someone at home gives it to you and knows it might help. The COVID-19 version of the coronavirus also has pieces that are designed to stick to the cells inside of our lungs. Our lungs help us breathe. So some people who are getting this new type of coronavirus are feeling stuffy in their lungs, and that can make them have a hard time breathing. They can have this difficulty breathing in addition to the other common symptoms, like aches and pains, a stuffy nose, a runny nose, a sore throat, or even an upset stomach. Anyone can get or spread the virus. It doesn't matter how old you are. It doesn't matter where you or your parents are from. What happens if you get coronavirus? Well, interestingly enough, it seems that almost all children and young people who get COVID-19 virus don't get very sick because their immune system is able to fight the virus off. Almost no people under the age of 18 have had very severe symptoms. Luckily, most people in general who get this virus will have mild symptoms, but some people can get very, very sick from this virus. This can include older people, like grandparents, or people who already have other problems with their health. These people are not able to fight it as well. We can work together to keep this virus from spreading to people who may have a hard time fighting it. How can we stop it? Well, the virus doesn't have legs, so it can't walk around to different people, and it doesn't have wings, so it can't fly around to other different people. That means to get into our lungs, the virus needs our help, and our mission is not to help the COVID-19 virus. Let's imagine that we have a little bit of COVID-19 virus on this cup. Now, I know that I don't have the COVID-19 virus there, but if I put my hand onto the side of the cup, I would get the virus onto my hand. Even if the virus is stuck on your hand, you don't have to panic. It can't go anywhere from here. It can't get into your skin. It only wants to get into your lungs. This is why we tell you to wash your hands often, especially before you eat anything, like your lunch. The way the virus is going to get into your lungs is when you touch your mouth, your nose, or your eyes. So rubbing your eyes because they're itchy, picking your nose for boogies, or putting your hands in your mouth without washing them first is what we need to avoid. This is how the virus gets into us and how we can get infected and pass it to others. You can see that washing your hands is really important to stop the spread of COVID-19 or any virus. Let's go wash my hands. Now remember, how you wash your hands matters. Soap is the most important part. You need to make sure you are scrubbing with soap for at least 20 seconds before you rinse the soap with water. You could sing the ABCs nice and slow, sing happy birthday twice, or even use a timer. Once you get a lot of practice scrubbing for the right amount of time, it will be easier to do it right all of the time. The other way you can get a virus or the COVID-19 virus is someone who's sick sneezes or coughs right on you. Yuck! What happens is their snot or spit carries the virus into your face. Gross. You might see some people wearing masks right now, and that is designed to keep their snot and spit inside the mask and not all over everybody else. If you're going to sneeze and you don't have anything to cover your face, go like this. And cover your face with your elbow. Don't sneeze into your hands. Gross. Because then anything you touch will be covered with your snot or spit. Ugh. We are all being extra careful to be apart right now so we don't spread the virus by accident to someone who might get very sick. You can help stop the virus by staying at home when you're sick, covering your cough or sneeze with an elbow, washing your hands often and correctly, and keeping your hands away from your face. That means your eyes, your nose, and your mouth. Now, hopefully you understand a little bit better what COVID-19 is and how you can help stop this virus from spreading, because that's certainly part of the WPACA way. Go Comets!